populations who may benefit from an intensive treatment model. Children and adolescents who are partial responders or non-responders to medication or to previous outpatient treatment may have greater success in a treatment where they have daily contact with a therapist. The accelerated momentum that an intensive treatment program offers is helpful for patients who have difficulty resisting OCD symptoms or difficulty practicing suggested interventions, such as exposure exercises, on their own between sessions. Similarly, for patients with symptoms that interfere with engagement in day-to-day activities or school attendance, an intensive treatment program provides the opportunity to complete treatment and improve functioning in a shorter period of time. The accelerated nature of intensive treatment might prevent a child from needing a higher level of care, repeating a grade, or switching a school setting. Finally, when an individual is discharged from an inpatient unit, residential treatment, or partial hospitalization program, weekly treatment may not be a sufficient next level of care. Instead, an intensive treatment program may provide a more gradual decrease in the amount of therapy time and support for the patient and their family, allowing for a later seamless transition to weekly outpatient care. Intensive treatment programs can be beneficial for a broad range of individuals and symptom presentations. The term intensive often implies that the treatment is for high levels of symptom severity. Indeed, many children and adolescents who experience severe OCD benefit from intensive treatment. However, the intensive treatment approach may expedite the pace of treatment and make treatment more accessible to patients with mild to moderate symptoms as well. Evidence-based care can be challenging to find, even for families who are aware of gold standard treatment strategies. There is a dearth of qualified mental health providers in many areas, leaving large populations facing the challenge of how to access care. Evidence-based outpatient treatment is often not an option if there is no local clinician who can provide specialized services. For patients who do not have access to appropriate evidence-based care, an intensive treatment program can provide the opportunity to spend as few as days or weeks in one place and receive a full course of treatment. Even among those who do live in areas that have providers with appropriate expertise, some families may opt to participate in intensive treatment programs because a treatment course can be completed over a school break or vacation period, when families have the time to fully commit. The level of detail provided in this chapter and in this guidebook on the established treatments for OCD assumes some previous experience and familiarity with gold standard treatments for OCD, particularly exposure and response prevention, ERP. Thus, a clinician new to OCD treatment who is looking for a step-by-step guide on how to implement ERP should consult other texts. This guidebook is an appropriate reference for clinicians, scholars, administrators, or other professionals with experience in the treatment of OCD who are interested in implementing this treatment in a condensed or intensive format. How to use this guidebook. Section 1. This section is designed to provide context and background for and benefits of the intensive treatment model. This chapter, Chapter 1, provides a review of pediatric OCD and describes the non-intensive, evidence-based treatment approaches for this condition, providing the foundation and context for the intensive treatment model. In Chapter 2, we describe the research support for the intensive treatment model, and in Chapter 3, we detail the clinical benefits of intensive treatment. Section 2. In Chapters 4 through 7, we offer a comprehensive guide for program implementation and development, as well as specific instruction on delivering treatment strategies in an intensive modality. We cover the range and possibilities for program structures, Chapter 4, barriers and logistics of program implementation, Chapter 5, staffing and training models, Chapter 6, and a discussion of treatment pathways that patients may travel, Chapter 7. Section 3. The last section provides clinical descriptions of and materials for the elements of intensive cognitive behavioral therapy, CBT, and ERP, and discusses the unique challenges and clinical applications of each core treatment element within the intensive treatment framework.